Hello and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and we're bringing you the latest information on women's health as we celebrate Mother's Day and National Women's Health Week. I'm here with Dr. Ogochukwu Oseji, an obstetrician and gynecologist who sees patients at MedStar Harbor Hospital, MedStar Health at Federal Hill, and MedStar Health at Pasadena. We'll talk about the importance of keeping up with your health screenings with guidelines from the American College of Obstetricians and Gynecologists, also known as the ACOG. We'll also look at the latest on screenings for anxiety and depression, cancer, diabetes, HIV, urinary incontinence, and more. We'll also talk about how to help soon to be or new moms. It's vital to reach out to your healthcare provider right away if you experience physical or emotional symptoms to keep you and your baby healthy and safe. So if you're looking for guidance for yourself or for other women in your life, stick around, share this broadcast with your friends, and please ask your questions in the comments below. Before we get into our questions, let's meet our expert. Thank you, Dr. Oseji, for being here. Will you tell the audience a little bit about yourself and the work you do at MedStar Health?
Hi everybody. I am Ogochukwu Oseji. I am an OBGYN working at MedStar. Like you mentioned before, I do work at Harbor Hospital. We have a clinic here in Federal Hill, and we do have a practice out in Pasadena. Yeah, that's what I mean.
Perfect. Well, let's get into the questions.
Absolutely.
So, to start off, what is an OBGYN? And should you see an OBGYN even if you're not having a baby?
So, yes. So the full name is we are obstetricians and gynecologists. So the obstetrician part is the part where we see, you your prenatal visits, we take care of you and your baby. And the gynecology part is essentially the women's only part, right? Where we do the real women visits, we do everything from birth control discussions, we even do a little bit of prenatal counseling and or preconception counseling, as we like to say. We do many things. We talk about periods, if you're having issues, pelvic pain, so lots of different things. So, and I think the second part to your question was, should you see one if you're not having a baby?
Yes.
Yes, you should. You absolutely should. Because again, we cover a little bit of everything else outside of just, prenatal care and obstetrician care.
Yeah. And so, since you do, like you said, kind of cover a wide variety of things, what age should someone start and then maybe even stop seeing an OBGYN?
So that can be a very tricky question.
Yes.
So there's not really a set in stone start or stop time. And it really is a discussion you would have to really have with your OBGYN. So for instance, I've seen a patient as young as 11, 12 years old who was having menstrual issues. So she came in, we talked about her menstrual issues. Of course, her mother was there as well. And we talked about a lot of the hormonal ways that we can manage that for her. And then as far as when to stop, again, good conversation to have with your OBGYN, because oftentimes, and we'll get into a little bit this later, I believe, oftentimes, people are thinking, I just need to come to the GYN to get my pap smear or screen for cervical cancer. And, you hit menopause and you're thinking, I don't need to come to the GYN anymore, but you still do. You still have a vagina, you still have, all those other organs that need to be cared for. But again, with that conversation, your GYN might say, hey, maybe you don't need to come every year. Maybe you need to come every other year. So not necessarily a certain time that you need to come or a certain time that you need to end. But I will say, at least with starting, if you're a teenager and you're having menstrual troubles, for instance, your periods are extremely heavy, or you're having a lot of pain with your menstrual periods, or you're starting to become sexually active and you're interested in STD testing, those are reasons to kind of start and see your GYN sooner than later.
Right. And so you kind of touched on this, but to go into it a little bit more, what services do you provide?
All types.
A ton, it sounds like.
We talk about a little bit of everything.
Yeah.
So, like I mentioned, in our younger patients, when they come see us, we'll talk about their menstrual periods. How are they? Are they extremely heavy? Are they lasting for 30,000 days? Are there ways that we can control that? Are you sexually active? Do we need to start doing STD screening? We do well woman exams or visits, as we talk about. And in those visits, we talk about your sexual health. We talk about your vaginal health, pelvic pain. If you have a history of fibroids, ovarian cysts, lots of different things that we can, talk about. We also, again, like I discussed before, preconception counseling. If you're even thinking about getting pregnant, Talk to your GYN about, hey, what could I be doing now to kind of get prepared for, childbearing in the future. We talk about menopause. We talk about urinary incontinence. So again, such a broad range of things that we can talk about and services that I provide.
Yeah, that's great. And you mentioned women visits, and why is it important for women to stay on top of scheduling those and on top of their health screenings?
So this is a very important question. And I'm going to start by saying that no one is going to take care of you better than you will take care of you. No
Yes.
one is going to advocate for you better than you will advocate for yourselves. And we know that in our society, oftentimes we take on the role of providing care for everybody else, from husbands, partners, kids, to older family members. And in doing so, you end up neglecting yourself. But, neglecting yourself can be detrimental to not only your physical well-being, but also your mental well-being. And it can lead to bad outcomes. And, if you're not getting those routine checkups, then oftentimes things might go missing. You might be ignoring that ache that has been, there for such a long period of time. And, ignoring that sometimes it could be something more serious. And, it's best to just come to those visits, even if you're like, I really don't want to do this. And I've had patients who say they really don't want to be here. But come to those visits, at least be checked out. You can at least, take the time to take care of yourself so that you can be a better person for the people around you.
Yeah, that's great. I love that answer. And at what age do women need to start doing these health screenings? Does it maybe depend each screening, or is there a certain, like around this age, you'll start getting these sorts of screenings? Can you explain that?
So yeah, it a lot of times it is age, relevant. So I did mention a little bit about STD screening. So
Hmm.
I know specifically there are some studies that say you should start HIV testing should be at least done once in your lifetime. But we also know that people engage in other high risk sex behaviors. They have multiple partners, or they changed partners recently in the last 2 to 3 months. That might be a reason to be screened more versus then spacing it out a bit more. Specifically, I know a lot of patients are really just coming to the GYN because I want my cervix checked. And we typically start those screenings at 21 for cervical cancer screening. Breast cancer screenings, we typically start at 40. So those are just some of the ones that we talk about. And then oftentimes we will check to make sure that you have additional screenings that are up to date. For instance, if you're 45, you need to start having your colonoscopy screenings. If you're 65, we recommend a DEXA scan, which looks at your bone density. So different things that we kind of take a look at.
Okay. And what are some of the most important cancer screenings that women should get, kind of keep top of the list to make sure they get when they're due for one, and maybe what are some of the guidelines for those screenings?
So some of the most important, being GYN, definitely the cervical cancer one.
Hmm.
Again, we usually start at 21 with those. And, I give or take, I know life, you don't want to come in to see the GYN when you're 21 years old. But, typically we do start in the early 20s. So 21, we'll do your cervical cancer screenings. And then again, as I mentioned, the breast cancer screenings, which we do start at 40. And that involves going to get a mammogram done. If you maybe had some genetic testing done in the past that recommended you do like an MRI for your breast, we might go ahead and send you for your breast MRI or your breast ultrasound, depending on what those findings showed.
Okay. And are there other important screenings that OBGYN should provide, maybe, other ones that you haven't mentioned?
Okay, let's see. So honestly, there are so many that I think oftentimes we as GYNs don't even realize we're screening for certain things, but we
Hmm.
are. For instance, we oftentimes screen for anxiety and depression.
Okay.
And we'll have patients come in, fill out a depression screening form, and we'll kind of go over that with them, see how they're feeling. Now, we may not be able to be the ones to, provide the more in-depth counseling or screening
Right.
for that, but at least we've looked at it and we can pass that on to the next person, or at least refer you to who we need to refer you to. We screenings for like vaccinations, make sure your vaccinations are all up to date, specifically for us, the HPV vaccine, which are which is a very good vaccine. We screen for obesity, and we can recommend weight loss that you might need to undergo. We do screenings for HIVs, STIs. We also screen for urinary incontinence, and sometimes we don't realize it, but we are when we're asking you, do you have any trouble peeing? or if you're peeing randomly or frequently throughout the day or even throughout the night, we are actually screening to make sure there's no urinary incontinence there. We also screen for like family history. What, is your family history have genetic issues where it comes to certain diseases or cancers that might affect you or could affect you down the line? So again, lots of different things that we cover for lots of different reasons.
Yeah, you all kind of do it all.
We really do. We
Yeah.
really, and I don't think I don't think I really realized it until you get patients that are like, well, can you be my primary care doctor? And I'm like, I can't, I'm not, but I get what you're saying.
Yeah.
But we screen for a lot of things that, people don't really think that we screen for.
Yeah, I know I had my appointment somewhat recently, and yeah, filling out the forms beforehand, I'm like, how does this connect to my appointment that I'm having now? But it does, it can all connect, and
it does.
And it's good to just get those things checked out.
Absolutely.
So I'm going to take a second and pause and welcome our viewers again. Thank you for joining us for today's discussion about the importance of keeping women and pregnant moms healthy. If you have any questions, you can ask those in the comments below. Getting back into our questions, Dr. Oseji, what are some behaviors that improve women's health?
So typically a lot of these, even your primary care doctor will really stick you on. So we're talking about smoking cessation. We're talking about avoiding excess alcohol intake. I know specifically I am talking about good sexual health and, is sex comfortable for you? Are you using condoms? Are you not using condoms? What are you doing to prevent getting unwanted pregnancy? What are you doing to try to get pregnant? So, those types of things. I'm also recommending avoiding substance abuse, good exercise. What are you eating? What good nutrition habits are you keeping? Maintaining good mental health. What ways are you finding to distress? What do you like to do for fun? We know society is stressful. The economy is stressful. So what are you doing to keep yourself at peace, and keep your mind, body, soul healthy?
Yeah, that's great. I love that. And then, like you said, you can kind of then point them in the right direction. You might not be able to, but you can point them in the right direction as to what steps to take next for these things.
Exactly. And, again, I'm not really the biggest, I don't really know much about smoking cessation, the little that I do know, but I can at least point you, okay, well, I may not know much about this, but I'm at least wanting to screen you for it, and I can tell you about the behaviors that maybe you shouldn't do that, you probably shouldn't do this, but if you're really at a place where I'm trying to stop, okay, well, I know somebody, and I know this person can lead you down the right direction and can tell you, okay, this is what you need to do, this is what you don't need to do.
Yes, which is perfect because a lot of times people don't know who to see for what, or, they don't know how to start that. So it's nice to have kind of the central point of contact that can then let them know and guide them with that. That's awesome.
Exactly.
So for women who don't practice healthy behaviors, what can happen, down the line if they continue these?
So we're talking about high blood pressure, hypertension. We're talking about diabetes. We're talking about morbid obesity, which has its own issues, which that can affect your bone health. We're talking about cancers. We're talking about substance abuse, overdose, mental health issues. And if you're doing a lot of these things and you're trying to get pregnant or you are pregnant, we're talking about poor maternal health outcomes for not only you, but also for the baby. So, lots of different things that can cause these issues.
And then talking more about maternal health, why are prenatal appointments important and what happens at these appointments?
Okay, so prenatal appointments are extremely, extremely important. And I feel like I'm oftentimes trying to fight with my patients to make sure they come to their prenatal appointments all the time. And, I've had to tell people, like, can you call them to make sure they come to their appointment because they need to, right? So prenatal appointments, it gives the patient and the provider, the opportunity to check up on the health of not only the mom, but also the baby. And, if the mother isn't doing well, oftentimes the baby isn't doing well. So during these appointments, we make sure to check up on both, right? That's the goal of that. And also at those appointments, we also do a lot of screening. And I think that ties into your second part of the question. What do we do at the prenatal appointment? So and I'll just go over a typical prenatal appointment visit with me. So for instance, my medical assistant will come in, she'll do your vitals, she'll check your blood pressure, she'll check your weight, she'll check your temperature. And checking your blood pressure, we're, looking at those fine numbers, making sure that her blood pressure has steadily started to increase throughout her pregnancy. We really need to keep a closer watch on her, or we might have some concerns for preeclampsia. We look at your weight to make sure you haven't gained too much weight during the pregnancy, or that you haven't significantly lost weight during the pregnancy, because again, those all have their own issues, right? And then, we ask you to leave a urine sample, and I've had patients fight me, why do I have to leave a urine sample? I'm pregnant, but it's okay. I'm going to tell you why. We like to check for protein in your urine. Again, that also has to do with like preeclampsia that could develop in the pregnancy. We also check for ketones, because if we're seeing ketones in your urine, are you drinking enough water? I've had patients lie to me about drinking enough water too. And I always
look at
out. Exactly. I always look at their urine and I'm like, you're lying to me. I know you're not drinking enough water. But we talk about what's been happening with you or with the patient since, the last visit that you were there, any issues that they need to bring up. We make sure that the baby's moving, we check on the baby's heart rate. We do the routine labs that are needed to be done during that visit, depending on the amount of weeks pregnant you are. And again, depending on the weeks, we might, give routine vaccines that we recommend in the pregnancy. We talk about the next steps as far as what's going to happen at your next visit. We do a good number of things, but I think a lot of times the most important thing that comes up during the prenatal appointments is just tell me what's going on with you and the baby. Like, and I always ask, how is the baby treating you? Are you feeling miserable? Are you feeling depressed? Is baby like preventing you from going to sleep at night? Because all those things matter, right? So how are you feeling with this pregnancy? Because we know that pregnancy causes a ton of changes throughout the body, literally from the top of your head to the bottom of your feet. So, just how are you feeling, and how is this baby treating you?
Yeah, that's great. Thank you for going over that. Where can women and families find resources while planning to become pregnant, resources during their pregnancy and even after pregnancy?
So I think sometimes one of the first places you can go is ask people who were pregnant before, especially if you have close friends who were pregnant. There are really good resources, because oftentimes they have great resources that people gave them. So it's always good to ask them at least. And we know there are tons of books. There are magazines that I've seen on the shelves. There are mobile apps that people can use. Social media, sometimes there's really good support. There's also support groups that I want to say MedStar offers, but I may be lying about that. That can kind of get you prepared for delivery, breastfeeding, postpartum care, mental health, all types of things. And I think MedStar also has a website that women can visit as well that can kind of direct you to where to go. So in this age of like social media, there are a plethora of places you can go for help. But obviously, at the end of the day, if you need to ask your provider, ask your provider. We're there for a reason. We're there to help you. And I think oftentimes what I have to tell my patients to get out of is, you don't necessarily have to wait until your prenatal appointment that's supposed to happen in 4 weeks. If you have a question that is really urgent and you're, really trying to figure out what you need to be doing at that time, send a message to the office staff, and they'll get that to the provider so we can help you out there.
Yeah, that's great. Yeah, that website you mentioned, we do have, it's medstarhealth.org/women's health.
Okay.
And we'll post that in the comments too for anyone watching that wants to check it out. Okay. And why is it so important? I feel like this could be a very broad question, broad answer, but why is it so important to take care of a woman's physical and mental maternal health?
So, because pregnancy literally can affect, again, everything from your head to your feet, and it's just so important. I know I'm going to get into it, but it's just so important because we know that pregnancy takes a toll on the body. So doing what you can beforehand, even before you get pregnant, to kind of combat a lot of those things that can happen during the pregnancy will definitely help. So one perfect instance is if a patient was exercising before they were pregnant. I oftentimes would say, please continue to exercise during the pregnancy because it will help you a lot. Now, I'm not saying if you were playing tackle football to keep playing tackle football, but at least, you can keep running on the field,
Yeah.
right? Right? You
Yeah.
can run with them, but you don't need to,
You
be
can toss
tackling
the ball
people.
around. You don't got to tackle them
Exactly. You don't need to tackle
though.
it. So, like, if you're lifting weights before pregnancy, keep lifting weights. If you need to go down in the weight, that's perfectly fine. Um, if you had a past clinical history of like mental health issues, what we know is that mental health issues a lot of times can worsen during pregnancy. So I often will tell my patients, like, listen, you have to keep in touch with your therapist, with your psychiatrist, or whoever you're seeing. And it's very important because pregnancy can cause, and those hormones can cause a worldwide range of symptoms, right? So it's important to keep in touch with them, even, throughout the pregnancy and especially after, because postpartum depression is real and it can be very disheartening for people to deal with. So it's definitely important, and I really urge a lot of my patients to, if you haven't really been seeing a doctor before you get pregnant, I think it's best to start seeing a physician or OBGYN even before you get pregnant, again, to start having that conversation of what can I start doing to make my body feel a little bit better before, I get pregnant, or yeah, I'm trying to get pregnant, I have these mental health issues, do you recommend I see somebody? And a lot of times people say yes. Are there vitamins that I need to start taking before I get pregnant? Yes, we would recommend that. So yeah, I think it's important, to at least before you even get pregnant, to just start that process of having the conversation with your, OBGYN of what you should be doing, what you don't need to be doing, and go from there.
That's great. Yeah. And before we go to my next question, I do want to touch, we have a question from one of our viewers.
Okay.
Ashley asked, are vaccines required during pregnancy?
So I love this question because are vaccines required? No. Are they recommended? Yes. You can opt out to have vaccines while you were pregnant. It is not anything that someone can put a gun to your head and say, you have to get this. Now, are they recommended? Absolutely. And I think specifically, we talk about, like, we have the Tdap vaccine. And the Tdap vaccine, we specifically look at that last P, which is pertussis. And that's for whooping cough. So the goal of that is to give you the vaccine in pregnancy so the antibodies can cross over to the baby. And, in the happenstance that baby is to get whooping cough after baby's born, you have a little bit of protection from that vaccine that you got in pregnancy, right? And then I know oftentimes people are concerned about, like, the COVID vaccine, RSV vaccine, and the flu vaccine. And, what we know is during pregnancy, you're already at a lower level of immunity. And your immune system is already working in overdrive. So typically in pregnancy, if you were to get any kind of respiratory illness, or, instance you have an asthma exacerbation or things like that, it's common that you might see worse symptoms in patients who are pregnant because, again, your immune system is already working in overdrive, because of this pregnancy. So that's why we recommend getting those flu vaccines, RSV, and COVID vaccines. But again, it is recommended. It is not required. We cannot force you to do anything in this setting.
Okay, thank you for explaining that. And thank you for your question, Ashley.
Thanks, Ashley.
What are some urgent warning signs for women during or after pregnancy?
Oh, okay. This is very important because I oftentimes have patients who, like, call the clinic and they're like, I need help with this. And I'm like, that's an emergency. You need to go to the doctor right now. So I think there is a paper, and I think they'll put it in the chat or later, but some of the urgent signs that we see: a headache that, won't go away or is getting worse over time. Now, the caveat to this, and a lot of these have caveats to it, is headaches sometimes can be normal in pregnancy. But the key word is won't go away, right? So you've tried everything. You've tried the Tylenol. You've tried just closing your eyes, getting rest, but you've noticed that, like, listen, this headache is just here. It won't, go anywhere. Then that's something that you definitely want to go to your doctor about, right? Because it could be, hey, maybe you developed migraines in pregnancy and you didn't know, or, as the pregnancy goes on, when we get headaches that won't go away, our main concern is that patient is developing preeclampsia. So definitely an urgent sign to really, get in contact with your provider about. Dizziness or feeling faint. Now, again, the caveat: some dizziness is a little normal, but you also have to check with what's happening, right? So have you increased your water intake? Are you drinking enough water? When was the last time you ate? Those things you need to check, for. But obviously, if you're just randomly fainting and you've done all the things, yes, talk to your provider. Something's going on there, right? If you have any thoughts about hurting yourself or your baby, again, those are those mental health cues that we're looking at. talk to your provider. Maybe we need to get you in with an urgent appointment to see a psychiatrist, or, maybe, and there's no shame behind this, maybe we need to, get you or take you somewhere where we can provide the right care that needs to be done there. Changes in your vision, and this is again along those lines with issues and symptoms of preeclampsia. If you have the perfect 20/20 vision, and as you can see, I do not. You have the perfect 20/20 vision, and then you suddenly are like, listen, I'm seeing all these spots in my head, in my vision, or even oftentimes this is associated with headaches. Again, that's a concerning sign for preeclampsia. Get in touch with somebody, get in touch with the clinic if you need to, or just go straight to the emergency room and let them know what's going on. If you develop any fever during the pregnancy, if you have any trouble breathing. Now, the caveat to that, we remember that you are carrying a completely different person. You have gained weight during pregnancy. So also shortness of breath is normal, right? Like if you're climbing the stairs, it's going to be normal for you to have a little bit of shortness of breath. But if you're like, I can't even walk a block, if I get up and walk, I'm having issues with breathing, then that's a concerning sign, right? Mm-hmm. And especially if that trouble breathing just doesn't go away, like you're lying down, you're like, I'm not doing anything. Why am I struggling to breathe? Yeah. That's definitely a concerning sign that we need to get you into the hospital quicker. Chest pain or fast beating heartbeat. So now while chest pain is not necessarily a common thing in pregnancy, fast beating heartbeat is, but there is a certain level of heartbeat that is okay in pregnancy. Now, again, and it's kind of with the shortness of breath. If you're just sitting down, you're not doing anything, and you're just like, my chest, why is my heart beating fast? That's a concern, But again, if you're walking up some stairs and you're like, yeah, my heart beats a little bit, but when I sit down, I'm calm, then that's just usually just a normal part of pregnancy. Severe pain in the belly that's not going away, right? Severe nausea or throwing up, the caveat to that. Now, we know morning sickness can be common in pregnancy, and unfortunately, there are some women who continue to have morning sickness throughout their entire pregnancy, right? But if it's to the point that you're telling me, hey, I haven't been able to keep food down for the last week or for the last 2 weeks, I'm losing weight, right? I actually recently had a patient who has lost almost 15 pounds from the pregnancy because she cannot keep anything down, right? So again, warning signs that you need to just go to the hospital, or at least try to get into urgently to see your provider so we can talk about the things that can get done. If baby isn't moving much or has stopped moving altogether, and I typically most of the mothers that I know, or women who are pregnant that I know, they have a certain idea of when their baby moves the most, or how often their baby moves. And when you start, like, you know what, I've been sitting here, I've drank juice, I've drank water, I've eaten, and I'm still just not feeling, baby move as much, come to the hospital. Mm-hmm. Any bleeding during pregnancy or any leaking of fluid, definitely come. And leaking of fluid, it can go either way, because we do know that a lot of, vaginal discharge does increase during pregnancy. So, oftentimes I would say, listen, put a pad on. And if you feel like you're soaking through this pad, or you're just feeling a lot of leaking through that pad, then come to the hospital. Let's check to make sure you didn't break your water, right? Mm-hmm. Vaginal bleeding or even leaking after pregnancy also is important. Now, we know that there is certain amount of bleeding that is common after delivery or after you deliver. But if you're like running through a pad an hour, that's too heavy. Too heavy bleeding, come to the hospital. Swelling in your legs, swelling in your feet. Again, swelling in pregnancy is common. But if it's to the point where you're like, I can barely see my feet, my ankles hurt, or things like that, or you've noticed swelling in your face, swelling in your hands, those are more concerning signs, and you should come to the hospital. Let's see, what kind of those? Or just being overwhelmingly tired, right? Like, I'm just feeling way too fatigued. I can't even hold the baby. I can't sit up. I can't do anything. Definitely signs that you should come to the hospital.
Yeah, I feel like that all kind of connects to what you said at the beginning too, about like you're your best advocate for yourself, know your body best. Like some of these, like you said, could be common, but not to this extent. And you know what that extent is for yourself, essentially.
Exactly.
Yeah. So that, and like we mentioned for our listeners, we'll put the warning signs picture up from the ACOG in the chat, so you can take a look at that.
Perfect.
And So we've learned a lot today as we wrap up our time together. Do you have any final thoughts for us or the message you'd like us to take after watching this broadcast?
I want to go back to my original statements. You have to take care of yourself. You have to. No one is going to take care of yourself better than you will ever take care of yourself. And I feel like I've been saying that for years now. And some of my friends know that because I've said that to them many times. You know your body, you know what you feel, you know what doesn't feel right, you know what just feels a little off. And oftentimes you will be the best person to come in and advocate yourself. And a perfect example of that is that's why I like a lot of times seeing my younger patients because I like to get that started early. So when I see my younger patients, I have them come in the room. Mom, you can sit in the corner, or parents sit in the corner. I want to talk to the child. And this is how it starts by being able to speak up and say, hey, this is what I need. This is what I don't need. This is what I feel. This is what I don't feel. I don't like how this works. I don't like how that works. It starts early and being able to speak up for what you need and what you feel like you deserve. So
Yeah.
my main thoughts.
That's great. I love that. I think that's the perfect message to end on. So, thank you to our viewers for joining us, and thank you, Dr. Oseji, for joining us too and
Of
answering
course.
our questions. For an OBGYN referral to Dr. Oseji, you can call MedStar Health at 410-354-0800. Thank you again for joining us, and we'll see you next time.
Take care, guys.